Hello and welcome to the OT Meeting Room. I'm your host, Deborah Battistella. In today's video, we are going to talk about possibilities for you, the practitioner, and for your clients based on the evidence of using mirror therapy for stroke survivors who have impaired arm function. This is a follow-up to the video that I made talking about the struggle that we as clinicians seem to have when it comes to implementing evidence-based interventions into practice. So if you haven't watched that video, this is what the thumbnail looks like, and you can find that on the YouTube channel. Know that the information provided in this broadcast is for educational purposes only. Now let's talk about possibilities for you, the practitioner. When you have knowledge about an intervention, and in this case, very specifically mirror therapy, you understand how to use it appropriately in your clinical setting. This will increase your use of that intervention and will also help you to be able to clearly identify if the client is a good fit for mirror therapy and if mirror therapy is a good fit for your client. This is going to lead to improved client outcomes. And when clients have good outcomes, their satisfaction improves too. Also, once you understand mirror therapy, you will understand that it is an excellent intervention and program for home use. I believe in starting a home program right away, because when we start that training, as soon as we start working with a client, there's more opportunities for us to ensure that they feel confident in using the intervention. And then we can gradually grade that intervention to one where they're performing that on their own in therapy downtime, which gives us more time as skilled clinicians to focus on more of those hands-on interventions that need to be used, focusing on improving their function in other areas. This is going to lead to a sustainable clinical practice. I'm curious to know, what does sustainability mean to you? When I think about it for myself, I'm the kind of person that I like to have a solid plan going into my day. And now that I've been a clinician for a while, quite a long while actually, I like having interventions that I know I can pull out and just use with people. And so I can do that with mirror therapy because I have been studying mirror therapy for so many years. And to me, that means less stress for me and the greater chance that when I'm finished with my workday, I will have more energy for myself when I'm not at work. Now let's talk about the clinical impact that we make. I believe we're always making an impact any way that we show up. And I invite you to ask yourself to reflect on the type of impact that you make with your clients. I know I have been in clinics where clinicians have not really known what to do, and they give their clients some interventions that aren't really related to their recovery process, or they're not as beneficial as something like mirror therapy might be. So the results of making a positive impact by using an evidence-based intervention with confidence, with competence, is going to increase your own ability to understand what you're bringing to the table. This, to me, is part of clinical confidence. And so the more competent we become in a knowledge area and a skill area, the more confident we become. Clients love working with confident clinicians. And when we are confident, our clients have a positive view of us and the rehab team that we're a part of. This also impacts our colleague perceptions, because when we are interacting confidently with our clients, our colleagues are seeing how we perform. And when they see that we are consistently implementing evidence-based interventions with a level of confidence, they will have more confidence in us and increase the referrals of their clients to us. So ultimately, this is part of an impact on the perception that people have of our own professions. So whether you're an OT or a PT, if you're the type of provider who provides meaningful interventions that are based in science with your clients, and your clients are getting good outcomes, that's a positive view of you in your community. To me, this is what an empowered practice looks like. One where we know what we are doing and why we are doing it, and where the clients that we serve feel like they can have confidence in us to serve them in the best way possible. So now let's talk about clients. What can they expect to experience as a result of engaging in mirror therapy? Well, there, as you can see from this slide, there are quite a few possibilities for them. The research shows us that people who engage in mirror therapy experience improvements in body functions and those component subskills. This includes increased upper extremity and hand range of motion, movement speed. They can experience improvements in proprioception, light touch, and temperature. This is pretty important if you think about it, because there aren't a lot of interventions that help improve those sensory impairments that some people experience. Also, hemi-inattention or hemi-neglect. Research has shown that people who interact with the mirror in mirror therapy have improvements with that problem. And then they can also experience improvements in instrumental ADLs. And this is because mirror therapy has been shown to improve certain cognitive components. And one study specifically focused on increasing independence. And so our Fianti and colleagues demonstrated that people in the groups who used mirror therapy as an intervention following stroke had more independence in basic and instrumental ADLs. And this ultimately leads to an improved quality of life, not just for the survivors, but for their care partners too. So we know that survivors have a better quality of life when they're able to move better, when their thinking is better, when their sensation is better, and also care partners. Now, in my opinion, not all care partners can or want to be care providers. And care partners are more like a part of a team for people. And if I have a client who has had a stroke and they have a spouse or a friend who is always showing up for them, and they really are a partner with them in their recovery process, they seem to fare better. And a good solid care partner can encourage a client to participate in their home program. They can support them and maybe in motivation if they're struggling with motivation. But the thing is, if they understand the purpose and the benefits of this intervention, then they are more likely to feel included in the recovery process and better equipped to support their loved one. Looking at client possibilities through the occupational therapy practice framework lens, we see that client factors are those body functions and body structures, those things that reside within the client and influence their performance in occupations. And then broken down further, we're looking at those specific performance skills, those observable, goal-directed actions that result in a client's quality of performing their desired occupations. And we know that when people experience a stroke and their impairments affect the quality of their performance, it really has such a detrimental effect on their lives. Now we can look at motor skills, process skills, and social interaction skills. Motor skills having to do with moving the self or the movement related to interacting with task objects. Process skills having to do with selecting, using, interacting with task objects. And those social interaction skills, being able to communicate and interact with others effectively. This is a chart that I made for you to view, to think about the common terminology that we use in physical medicine settings and compared with the occupational therapy practice framework. This is from the 4th edition. And if you're looking for more variety in your documentation, you may want to consider comparing common terminology with the language in the OTPF. It can be very helpful for expanding your documentation skills and further supporting the use of mirror therapy for your clients. All right. Well, this wraps up this video. What can you do next? Well, I encourage you to watch part 3, where I answer frequently asked questions about mirror therapy. You can also listen to the Noggins and Neurons Brain Injury Recovery Simplified podcast. You can check out the OT's Guide to Mirror Therapy. This is a program that I made for occupational therapy practitioners to know how to use mirror therapy with your clients. It has a structured program. It has a full protocol. There is education in there for you as the clinician, separate education for your clients. If you're struggling to explain mirror therapy to them, I help you out with that. And just helpful hint, if you're a physical therapy practitioner or another discipline who frequently works with stroke survivors, this might be a good program for you to use as well. And lastly, if you're interested in learning more or receiving some consultation or mentorship from me, please feel free to reach out. Check out the links below for information. Thank you for watching, and I hope you make it a great day.